Access to basic health resources can be difficult when living in rural areas. Organizations like St. James Health and Wellness is closing that gap. Let's welcome James Holloway and Brenda Perkins with the nonprofit. We appreciate you coming here. We appreciate your work. So first, James, if you can tell us what your mission is all about.
So our mission at St. James is to provide quality health care to people, no matter their condition, no matter what they've gone through. We want to basically get out into communities, especially rural areas, provide health and wellness, and focus on, educational services, pediatric services, and primary care services.
So it sounds like there's a lot of education involved, but then there's also people there to help them. And where do you bring in those resources from in order to provide those services?
So we are a federally qualified healthcare center. So we have 7 different sites in Georgetown, Berkeley, and Charleston County. So and we have different partnerships with MUSC, so different collaborations and partnerships around South Carolina.
Brenda, maybe you can share with us what are some of the, I guess the more popular, the more average reasons as to why an organization like this is so necessary. What are some of the reasons that people come and utilize your services?
Okay, being a certified community health worker, in the rural area that we serve, all of our centers are located in rural areas. We know that families can't afford financially, they can't afford to go to receive medical care. So with our resources, they can come to us and we can see patients with insurance as well as uninsured patients. And we also connect them to other resources, like we partner with other organizations, like you stated before, MUSC, Tidelands Health, Camp Baskerville for food. We have a doctor that comes in that helps them with their glasses. We have a dentist that we partner with. We partner with Helping Hands. So we have different resources that they can get through us that they wouldn't be able to get services through anyone else.
Oh, that's incredible. So it sounds like really holistic 360 approach to care and wellness. And would you find that the population is growing, that we're seeing more and more people living in these rural areas and then needing more of these types of services?
Yeah, especially when you look at Georgetown County, and it's grown, and we want to make sure we're able to provide those adequate, services to everyone.
Yeah, most definitely. And do you need volunteers? Do you have a need for people?
Sure, we're always looking for volunteers when we do our events as well. One thing that we're partnering with now with Low Country Food Bank, so we'll need volunteers that can come in and help in the food bank, and that's going to be an incentive of becoming a patient of St. James. So in our McClintonville site, McClintonville doesn't have any grocery stores. There's no grocery stores in McClintonville.
I know that very well.
St. James has partnered with the Low Country Food Bank, where we're going to have an on-site food bank where the patient will, and when they come in to see the doctor, if they have a need, they can shop while they're there at the center.
That's incredible. Do we ever see that changing? Because, with all the senior citizens that live in that area, and for people who are not as mobile as others, I drive through there all the time, and I wonder to myself, you barely have a couple of gas stations. There's nothing there. How do people get from one place to another? They rely a lot on help from friends and relatives.
And public transportation. They do have a public transportation now that comes through the area, but normally it's family.
Really?
And being the center, and we're in the center of that community, that's where we want to try to help bridge all of those gaps.
That's wonderful. Yes. That's great. And I know that the people who take advantage of your services appreciate that as well.
Yes.
You do have an event coming up on February 17th. Where is this going to be held?
The event, February 17th, is actually going to be on Powell Road in Georgetown, South Carolina at our Sanford site. We're going to do free vaccine as well as a free food distribution along with Camp Baskerville.
Okay, wonderful. And people who are not aware of your services, I know a lot of word of mouth, but for anyone who's watching this who is not familiar, how do they find out more information?
So they can find us on Facebook, St. James Health and Wellness, or they can visit our website.
Okay, and then we can even put a phone number up there too for people who may not have internet.
Right.
That's also very possible. All right, well, I want to thank you both so much for joining us and sharing with us your organization.
Thank you for having us.
We're back after this.